This is Brent of the Brookbush Institute, and in this video we're going over static manual release of the Adductor Magnus. If you're watching this video, I'm assuming you're watching it for educational purposes and that you are a licensed manual therapist, that is a physical therapist or an athletic trainer, a chiropractor, a massage therapist, an osteopath. The laws in your state cover your scope of practice to perform manual release techniques. If you are unsure, please look those laws up. Personal trainers, this video probably does not apply to you. I'm going to have my friend Melissa come out. She's going to help me demonstrate. Now, all of these static manual release techniques follow very similar protocols. We have to know how to palpate the muscle we're targeting. We get bonus points for knowing the trigger points because that'll definitely narrow down our search. We need to know if there's any tissues that perhaps we should be watching out for that don't like compression. In the case of the adductors, we do have to be aware of the femoral artery. The femoral artery isn't huge underneath our fingers. Remember that arteries aren't going to be any thicker than your pinky, so if you do happen to feel a pulse while doing this, don't freak out. Just move up or down or side to side, and you should be able to find a way to the targeted tissues without compressing that artery. And of course, last, we need to know what position we're going to put Melissa in so that I'm comfortable. I can apply this pressure for a long, sustained period of time, being 30 seconds to 2 minutes, without fatiguing, and that Melissa's comfortable. I'm not putting her in a position of pain, and that we're adding some tension to this muscle so that we pin down those nodules or points of hyperactivity and don't start playing the put your finger on top of a marble game where that marble just keeps slipping out. Now, in the case of the Adductor Magnus, I use the same position that I use for the Adductor Magnus stretch. Right? So I put her foot up on my ASIS. Now I have total control of how much tension is in her Adductor Magnus because I can just move back and forth this way. If this is way too much of a stretch for her, I can back off this way. If this isn't enough tension, I can take a step forward. And of course, if I get my table up nice and high, I can get my arms out straight with my elbows near locked, and I'll just be applying pressure by leaning forward and using my body weight instead of trying to use my hands, which is eventually going to wear me out. Now, finding your Adductor Magnus isn't particularly difficult. It is the most posterior of the adductor muscles. So if I kind of attack the adductors from the posterior side, going this way, I'll be on the Adductor Magnus. The only thing I have to differentiate is where's my Adductor Magnus versus where's my hamstrings. In an athletic population, you might see their hamstrings popping out just by looking down. In Melissa's case, I can actually see a nice little bump where her developed hamstrings are sticking out, and I know if I put my fingers right above that bump, I'm on Adductor Magnus. If you can't see that bump, you can't get a good visual indication of where the Adductor Magnus starts, use one hand and kind of use like a nice broad area, kind of grab the back and inside of their thigh, use your other hand against the back of their heel and have them flex their knee. Remember, your Adductor Magnus doesn't cross the knee, but your hamstrings do. So you'll feel an increase in tissue density. You'll feel their hamstrings contract, but their adductors won't. All you have to do is go just above that contracting tissue. Good. Go ahead and relax for me. All right, now, I mentioned I get bonus points for knowing where those trigger points are. In the Adductor Magnus, we have one that's like basically right in the middle of the thigh, and then one that's very close to the ischial tuberosity, okay? So way up close to the origin of the Adductor Magnus. Now, I'm gonna use these posterior to anterior kind of swiping motions to find the most dense, most tight fascicles. And then once I find them, I can start moving a little bit more proximal. In this case, I started just a little distal of the midpoint of her thigh. And I find a nice tender point right there. Once I find the tender point, in this position, I'm going to use a thumb over thumb technique. All right, I'm going to kind of lock out my elbows here, and then I'm just going to lean. I'm only going to lean enough to get some good pressure on those dense fascicles. Now, remember I said good pressure is kind of where You push until you start feeling a little give back, but you don't get that huge increase in give back, that huge increase in resistance, because at that point you're probably getting guarding, you're probably going to get some pain, and it's actually going to be harder to get a release. We want to go just up to the point where we start getting an increase in tissue resistance or an increase in pushback on our fingers. We're going to hold this for 30 seconds to 2 minutes, or until we feel a release, likely closer to 30 seconds once you get good at this. Once I get a release, I can move on to the next trigger point. Now, I've said this in many videos. Before you put your hands on somebody, you should be 80% sure that that muscle is involved. You don't use manual techniques as assessments, at least initially. Of course, everything we do is an assessment, but you should have a good reason for putting your hands there. And this is especially true of the adductor magnus trigger point at the ischial tuberosity. Your hands are going to be very close to somebody's groin. This is something that you're going to want to explain to your client, build rapport. Don't just put your hands somewhere and not give your client a good indication why. You also are going to want to probably have a post test, right? So I had an assessment. I think this might help. I'm going to do this post test to show you why I put my hands there. You guys just put your hands where I'm about to put my hands and have no explanation, and you could get yourself into trouble. So the adductor magnus's origin is all the way at her ischial tuberosity, which is essentially what's holding her up on this table right now, right? Those are the bones deep in your backside. So if I come down closer to her backside, feel these same tissues, I can feel a trigger point right here. Same thing. Notice, guys, I kind of have my hands turned this way, right? I don't want my hands over somebody's groin. If you needed to, if somebody felt more comfortable, you could have them place their hand over their groin, or use a towel, or have them place a towel and their hand over their groin so that they feel safe. And again, I'm going to go ahead and hold for 30 seconds to 2 minutes until I get a release. How does that feel? Starting to relax? Good deal. And then at that point, I'd probably be like, okay, why don't you get up and do a squat? Maybe that was where she was feeling this pain. In the next segment, we're going to do our close-up recap. All right, guys, for your close-up recap, I'm going to take her thigh into flexion and abduction just like I would for an adductor magnus stretch. I'm going to put her foot on my ASI so that I can control how much tension is within her adductor magnus just by leaning forward or leaning back. Now, we know that her adductor magnus is the most posterior of the adductor muscles, so we just have to differentiate between the adductor magnus and hamstrings. Now, Melissa here has some pretty well-developed hamstrings, but to show you guys how I would differentiate on somebody who maybe wasn't quite as athletic or quite as well-developed, I'd use a nice broad part of my hand so that I could feel all of the inner thigh and all of the posterior thigh. Add a little pressure there so I know I'm feeling through any adipose tissue. I'd use my other hand to block the ankle and then have them flex their knee, and boom, their hamstrings pop right out. Remember, your adductor magnus doesn't cross the knee and is not responsible for knee flexion. So if I go right above those now contracted dense fibers of her hamstring, I know I'm on adductor magnus. Now, you guys can actually see this on camera. If I just have Melissa go ahead and flex her knee, being that she's athletic and has these well-developed hamstrings, go ahead and relax and flex again. You can see her hamstrings just pop out, and if I go right above those hamstrings, I know I'm on adductor magnus. Good, go ahead and relax for me. Now, with the adductor magnus, I know her trigger points are going to be right about the mid portion or middle of the length of her thigh, right, or right around there. And then there's another trigger point that's pretty close to the origin of this muscle near her ischial tuberosity. So I'm going to go ahead and take these posterior to anterior strokes, making sure I stay off the femoral artery, but look for the densest fascicles. Once I find them, I can then start moving a little bit more proximally here, since I started a little distal to the midpoint of her thigh. Once I find that point, I'm just going to go thumb over thumb, lock out my elbows, and apply some pressure right until I get a little kickback from that tissue. I'm going to try to hold still as I can, ensure that Melissa's fairly relaxed here. 30 seconds to 120 seconds, and then hopefully I get a release. Now the other trigger point we have is very close to her ischial tuberosity and close to her groin. I mentioned that you could drape this area. You could have your patient or client cover their groin so that you don't risk bumping into it. Melissa's going to go ahead and uncover herself so that you guys can see my hands for this particular technique. But her ischial tuberosity are essentially the bones that are holding her up on the table, right? Those are that pelvis bone that's deep in your gluteal area. But if I kind of start there, around the origin of this muscle, you will notice that there's some tightness, some density, these hyperactive local points just 2 or 3 inches distal from that origin. And then again, I'm going to go ahead and use my thumb over thumb technique here. Hold for 30 seconds to 120 seconds. As I mentioned before, guys, this is important time for you to have assessed and have a very good reason for your hands to be here. And this might be one of those techniques where I test right after I do the technique to go, all right, this is why we did the technique. Do you feel better? Hope you guys enjoyed the close-up recap. There you have it, static manual release for the Adductor Magnus. Remember, if you're going to do a manual release technique, you should be 80% sure that that muscle is involved from your movement assessment. Don't use manual techniques alone as assessment. Especially in the case of this technique, you're going to want to pre-test and a post-test and give your client or patient confidence that you put your hands where you put your hands for good reason. I would definitely suggest in the case of this and all manual release techniques that you grab a friend, grab a fellow student, grab a colleague, grab a fellow professional. If you can, grab an experienced manual therapist to practice this technique on first before trying it on a client or patient. There is no better education than being able to practice this on a fellow manual practitioner and have it done to you by that practitioner and start exchanging notes. These videos are great, but they do not make up for the practical application component that you will need to feel comfortable in practice. I hope you guys enjoyed this video. I look forward to seeing your comments, your questions. I'm happy to answer anything you guys ask. I'll talk with you soon.